me if you are logged in that you can go ahead and see my screen and hear my voice, and I hope that we are coming through loud and clear right now. So welcome to all of you, and it is good to have you here. Let's go here. And it is great to have you all here. Let me just get a couple more things going in the right way. And if you guys can tell me that you can hear my voice and see my screen, that would be great. Anybody that can, on the webinar platform at least, I know we are on multiple platforms. But let me just go ahead and do this. I'm going to put that back on. And I am going to go ahead. And if you need to go ahead and email me, then by all means, feel free. Okay, you can hear my voice, you can see my screen. I am going to give you the truth about PDO threads, and I hope I'm just going to do this. And I don't mean to insult anybody. I think the reason that we do this primarily, hang on a second, I think this will help. I've just got to plug in the speaker too. I think there is a lot of misunderstandings, a lot of problems in the area of PDO threads. I'm talking about in the U.S. I cannot speak for outside of the U.S. But right now there are multiple issues, and the AAFE regularly is we get lots of phone calls from lots of medical, dental, and nursing regulatory boards, and this is a big problem right now. Hang on a second, not sure what the problem is here. Don't do that. Give me a second here. I don't know. GoToWebinar is going a little crazy here. Here we go. Let's go back. Okay. Now let's try that again. Let's see if this helps without going too nuts. Okay. All right. Now you guys should be able to hear me. That's behaving a lot better. Okay. All right. Still on GoToWebinar, you guys on, I know we're on Instagram Live. We may be in other platforms there as well. Sorry, just had to throw something in. All right. Here's why we're here. We are here because the AAFE, as you know, and we give certification courses in botulinum toxins, dermal fillers, and PDO threads, and we get lots of questions, and we are also used as a resource by many medical, dental, and nursing boards. And this is an area that keeps coming up, just like the area that has come up in the past where or it still comes up where there are injectors or professionals, whether they're dentists, physicians, nurses, nurse practitioners, or physician assistants, that will go ahead and inject botulinum toxins, not from the manufacturer, that they get from Canada, Mexico, from overseas, from places that they should not be getting them. You get fillers from all kinds of places. They cause problems. You get a patient complaint. They come down to investigate. The first thing they want to know is, what are you using? And this is the problem that you have with literally your license at risk. Heavy duty fines. They are not fooling around, and they certainly can go ahead and get you. So this is less of a problem now. I think most people are have finally found that it's not worth saving a few pennies to put your license at risk. But certainly some don't care and put their license at risk to save a few pennies. I don't know about you. We work too hard for our licenses. Now, you know, that's toxins, that's dermal fillers. PDO threads is the Wild West, and we've got to clear it out. We've got to get our act together. So let me give you the honest to goodness truth about PDO threads and FDA clearance. This is 2.5 years worth of research by the AAFE about these areas here, and we do a lot of work with the FDA. We do a lot of work, like I said, with all the regulatory boards. So let's get into this here. First of all, by all means, there is my email, drlewis@facialesthetics.org. My name is Dr. Lewis Malcmacher, and I am president of the American Academy of Facial Aesthetics, as you know, and we are, a training organization. Most certainly, we definitely think we're the best. And we're all about certification training with real CME and dental continuing education and nurse practitioner. We got all those different certifications here for that. So if you'd like to contact me, or if you're interested in working together specifically in the area of PDO threads, we would like to hear from you. But we are just going to jump right in to this. PDO threads in the U.S. We're going to look at this 3 different ways, and we will try to do this I don't know about quickly, but as thoroughly and in as short of a time. But I'm happy to take questions at all for this. So we're going to look at it three ways. Those PDO thread manufacturers or distributors that have an FDA cleared class 2, what else is needed to make sure that you have a real product that you are able to use from a regulatory standpoint in the US, and then important clinical differences between available PDO threads. That's, if you're going to do them, this would really help and apply to you. So let's start with the 510K. A 510K is a document that a PDO thread company or a filler company or a botulinum toxin company or any medical device that you use, but let's just stay in injectables for now. These are a 510K puts you as an FDA cleared class 2 medical device. There is no question an injectable, okay, now Botox is a pharmaceutical, but there is no question that an injectable like a dermal filler, which is a medical device, or a PDO thread needs an FDA cleared class 2. That is no question about it, okay? And there are companies in the PDO threads in the US that will tell you that no, it's not necessary. Oh, we're going to get it soon, and we've heard that for 4 years. And you don't need a class. As long as we're listed with the FDA, doesn't mean anything. No, you need a 510K is a document, which means that they have submitted some kind of testing to the FDA, and they say we're equivalent to another product that is already cleared, and therefore this should be it. The FDA then issues a document called a 510K, but you need more than a 510K. That's just the first step as being an FDA cleared class 2 product there. So you will need something else, but then, like I said, we're going to go to that. So here are the companies that currently on the US have an FDA class 2 cleared PDO thread with an F510K posted with the FDA. There's your list of companies as we go through them. And again, we've evaluated hundreds of brands from around the world in the AAFE to determine what we are going to use in our certification training. And that's obviously, it's important to us because it's got to be an FDA cleared class 2. We've got to do everything right for that. The one that we use, and I'll show you some cases of compared to other brands that you see here, is called V-Soft Lift. Some of you know, and if the brand you use is not on this list, okay, unless, again, if there's a company out there that has a 510K that I may have missed, we've been working on this for a long time, and this is as of today. Of today on the FDA website, these are the ones in the US that have a 510K listed with that. But again, it needs the next step too, which I'm going to get into. If your brand is not on here, what's my recommendation? Just my opinion. You should not be using it. It is like using a fake Botox or a fake dermal filler. It does not have a 510K. That's the least you need, right? And you should not use it. You put your license at risk. You risk heavy fines. As soon as there's a patient complaint, you are in trouble. And I know there are other brands that are on there in the US. I've heard from them even today before and yesterday before this. I've even heard from a couple of these brands, who are not too happy that I'm putting this all out there. But you've got to know this. It's your license. You're the healthcare professional. So V-Soft Lift is the one that we use because it's a combination of strength and quality, best collagen production. And again, in our testing, we've tested just about all of these. And in terms of price, Nova Threads is a well-known brand in the US, and they've got a 510K. They've got a 510K that is listed for that. They just introduced, they go by Barb 1, 2, 3, 4, 5, and they just introduced a Barb 5. I don't know that much about their threads. You would have to talk to a Dr. Rajani, Anil Rajani, a good friend, about the Nova Thread system and some of the other people that are out there, and compare which ones do you like. V-Soft Lift has a combination of lifting threads that have a sharp tip, which is so much easier for those of you who've never used it, or blunt cannulas. Nova Threads is one that's been out there. Mint's Hans Biomed, Mint PDO. It's by a company called Hans Biomed. They've got a 510K listed with the FDA, and I'm sure you've heard those. Those are probably the 3 top brands in terms of sales in the U.S. For that. Miracu is another one. Asufil, many of you may not know it. It's an Italian company. They make very, very limited. I think their largest lifting PDO thread is a 21 gauge, maybe. That's their largest. MediGlobal is another one. And again, we're only talking about the 510K. It needs something else, which I'm going to show you in just a minute for that. MediGlobal has some twisted threads and lifting threads. They don't believe in smooth threads for some reason. PDO Max is another one as well. So those are the ones that have one part of it. If you're not on here, I'll say it again till I'm blue in the face. You should not use it. I don't care how many medical directors they have. I don't care if they've got top plastic surgeons as on their board or as their medical director. It doesn't matter to the FDA. It doesn't matter to your regulatory board, your medical, dental, or nursing board. They don't care. By the way, it doesn't matter to your liability insurance. If you're not using an FDA cleared Class 2 PDO thread, just about in every malpractice insurance across medicine, dentistry, and nursing, certainly medical spa, there is information in there about you have got to use something that is an FDA cleared or a governmental cleared product for that. An FDA Class 1 does not cut it. All it means, what all FDA Class 1 means is call it, Miracle PDO threads, went onto the FDA website, paid a $5,000 or so fee, and just listed it. That means nothing. Okay, absolutely nothing. So if your thread company is not on there, my high recommendation, you do what you want, ask your attorney, then you should not use it. And I hate to tell it to you because some of you have thousands of dollars of threads that you've used. And I don't care if the dermatologist or plastic down the street uses it, they get fooled just as easily as anybody else. Here's the second big part of this. So now a company has a 510K with the FDA, issued from the FDA. But how do you know that the thread that they got the 510K for is actually in the package? Well, you don't unless it's properly packaged with what the FDA requires to be on every single package. Do you think the FDA wants a blank package? No. A blank package means that you, the provider, have no idea of the real source of the threads. So in other words, someone with a 510K of some of these companies I mentioned before, and I'm going to show you, unfortunately, that some of these do. Some of these companies I mentioned before have a 510K, and they've got fancy packaging. But when you open the package, each one of these bags of threads has a little sticker on it with no identifying information, no company information. This is not FDA. This is not an FDA cleared part of the system. They have a whole system in terms of how you package with the lot number so that they can track it down. Do you notice every single Botox or Xeomin bottle that you get has a lot number and the control numbers so you know where it is? Do you notice that every dermal filler has got those little stickers on the syringe so that you can track if something goes wrong? They are not blank packages like this, are they? No. So I don't care whether or not, if it's an FDA cleared Class 1, we already knocked them out of the picture. It shouldn't be used. If they're an FDA Class 2 and they have a 510K filed, but they have blank packaging, I would strongly recommend, my opinion, that they not be used. If anybody tells you, oh, don't worry about it, then they pretty much are not telling you the truth. This is all part of the FDA. It also goes to the packaging there as well. So that is not proper. Here is what is proper. And again, this is the V-Soft Lift line here. And if you can see on the bottom of your screen, you can see it's got lot numbers. It's got expiration dates. It's got properly, every single one has got what kind of a thread is it. It's got expiration. It's got the date of manufacture, and it's got the expiration date. That is, now what do I know now from this company and the other companies that do this in the US? I know that they have a 510K filed with the FDA. I know that they printed on here that this is the thread that they are vouching is on the FDA Class 2 clearance 510K. It's properly marked. I can track it if something goes wrong. And it's 1 in a million, but it doesn't matter. It's your license at risk. I can track it if something goes wrong. If you go to a blank package, then I don't know. I don't know what to tell you. They should not be used. And if the company gives you all kinds of excuses, as they will, and of course they will tell you that I'm not telling the truth, that's okay. You ask your attorney, you ask your regulatory board, you ask your liability insurance what they will go ahead and cover or won't cover for that. Now, I have now made everybody that's not on this list unhappy, and now I've now made people that are on this list that have blank packaging unhappy, but it's not me, it's you. Okay, you're the ones. Get the right packaging as you are, and this way you can verify that it is the right thread for that, and it also does correctly identify. We're going to go ahead and show you a little demonstration. This is one of the brands of PDO threads on the US market that does have a 510K filed with the FDA, and properly on the outside they have the distributor. This is all in Spanish, so that I don't know if that's the best choice for the US, but it also does correctly identify their manufacturer. That's important. Here's where so many or the number of companies of these that have a 510K in the US fall apart. And I'm just going to open this up so you can see me open it just from the get-go and pull these out. Here are the threads, and this is their Super Tornado brand. There is nothing on the back here. That means that while this company has filed a 510K, they are lacking in the second more or most important part, is that every single package should be labeled with their name and also with identifying lot number and everything, so you can track it down. Just like every bottle of neuromodulator, neurotoxin, and dermal filler has got those little stickies that you can use to identify it and should go in the patient's chart. Let's just make sure that nothing else in there, so I'm not missing anything. So that is, while they may have a 510K, this is not the right packaging, which means this could have come from anywhere and may not fit the 510K. This is another brand. I did block out the company's name and information here. It only had the distributor name. It did not have any manufacturer's name. This company on the U.S. market does not have a 510K, so it is a Class 1 FDA, which is nothing. It only means that they went ahead and just filed something on their own for them. They have something here just to try to kind of nudge you to think that that the FDA is involved, but it is not. This is their number that when they created the account, that's the number that they got. It means nothing. This is an FDA cleared Class 1 product. I love how it says that they're a customer-centric company. Well, if you're customer-centric, you may want to go ahead and get a real Class 2 FDA that your customers require, and that's unfortunate. So let's open this and let's see what's inside, see what kind of packaging is inside. And this is a bunch of threads in here. I'm going to try to do this without showing you the company name, just because I don't want to have any problems later on from this company, but it is something that unfortunately many of you may be using now. And just to show you, we're going to just take it right out of the bag here, so you can see. And these are all just a bunch of threads with blank packaging. You know what that means? Well, this has got one little sticker on here that doesn't really mean much of anything for that. This just tells you that it's a PCL thread for that. But the rest of this, you don't know what this is. You don't know the manufacturer. You don't know the lot number. There's no identifying information. Should this be used legally and from a compliance standpoint? Absolutely not. So if you have got a company, whether they have a 510K or don't, and it's blank packaging, if they have a 510K and they're Class 2, FDA Class 2 cleared, that's at least half a step there. But if it comes like this, don't use them. If they don't have, they're only class 1 FDA, absolutely do not use them. There is no idea where the source of it. Again, they don't identify the source of it on this distribution. This is not FDA cleared, and your license is at risk. All righty. Sorry that video didn't play completely the way it should have, but you got the message. I hope you got the message. Now, here are what companies claim, and is it truth or not truth? Does it really help? Maybe, maybe not, but it doesn't really matter. An FDA class 1 clear, no, it's not cleared. An FDA class 1 company, they just listed themselves on the FDA website, says they have $1 million liability insurance policy. Well, so do you. That's irrelevant. And every thread company should, I don't know, I think most of them do, have a liability insurance. Their liability insurance does not help you in the least bit if they're not FDA cleared class 2. It's really simple. It's a simple equation for all this. Now, this is literally something that somebody called that they bought a big package from one of these companies that is not FDA cleared class 2, and they said, what's the deal? And they said, and this is literally taken from an email that somebody sent me that was sent from one of these companies. Oh, the FDA made some changes on the classification of threads because of COVID. Absolutely not true. We have regained class 2 because of the new threads we've patented. Absolutely not true. They never had it to begin with. I'm forwarding your email to corporate as they can explain things in more detail, and they never heard from corporate. So this person is like, should I use these threads? And the answer is no. Yeah, I mean, again, if you want, you paid for them, but you know, you're putting your license at risk. Is your license worth it to you? I would say no. Another company, actually the same company here, take a look at some of these, and this is a company that has a European flavor to it, and I can say that about a few of the companies that are out there. So I can say it broadly for sure, but some of you, if you know the companies, may want to take a look. Take a look at their team or their faculty, whatever they call it, and take a look at their medical directors and their boards. Their medical director and board makes no difference if they're not an FDA cleared class 2 PDO thread. It doesn't matter. They could have literally Moses on there. I don't know if Moses was a doctor or not, but they could have Moses on there, and it doesn't matter to your regulatory boards. That's number one. But number two, I mean, it's so unusual. I mean, and you just see, you know, how far people will go to you know, try to try to make something that they're not. Take a look at, and if you know, take a look at every thread company and see who their faculty or team is, and you'll see that the owner of one of these companies actually has a doctor on each side of them, and in front of their name, if you look carefully, it looks like it says DR for doctor, but if you look really carefully, it says DIR, which I think means director. But if you read through it, yeah, it makes them seem like they're a doctor when they're not. And why would people go to such lengths to try to really deceive other people? It's just, it's amazing. This is what I said. It's crazy what's going on in the PDO threads. But it doesn't matter because you're the responsible party because you're putting these into patients. Another company claims we are only one of 2 FDA cleared PDO threads. Well, I just showed you 6 or 7 of them. Whether or not they have the right packaging is a different matter. So if you're going to use threads, take a look at your thread companies. And those of you who are on, we have a ton of you online. And a ton of you on, we have a ton of you online. We have a ton of you on the webinar forum, and I'll answer questions there too. But you know, you need both. So, I mean, people are asking, well, you know, if I open it up and it's a blank package, should I use it? Well, I'll just say it this way. I wouldn't use it, and I don't think that you would use it. I would not tell any AAFE member to go ahead and use it. I don't care if they have a 510K or not. If it's a blank package, you don't know the source of the thread, and ultimately, you've got a problem. Do you want I mean, it's hard enough to get liability insurance to pay. They give them any excuse not to pay, okay? And they will not pay if they have any inkling that there is a problem with the product, and they're going to say it's you. You'll go back to the company, and they'll say, oh, yeah, whatever, and these companies say, oh, we're getting it soon. Well, good. Buy them when they get it. I mean, it's pretty much that simple. You got to protect yourself. That's number one. All right, let's do a little bit of clinical, and then I will answer questions for that. Nicole, you mentioned one of the companies that is not on the list, and obviously is not something that we would recommend anybody use. For that. So I mean that I think you guys get the gist of that. And again, and John and Pam and Fred and Rick and Tammy and Carrie. All of you are mentioning thread companies that are not on the list. I would not use, and a few of you are mentioning a company that is on the list that likes to use a lot of the influencers on Instagram, the injector influencers, and that doesn't matter how many influencers they have. I don't care if they have a 510K, if they have blank packaging, we would not recommend them and we would not use them. And believe me, I've heard from a couple of these companies before, and I'm sure I'll hear from a couple of these companies afterwards. They were heavy, but again, I'm here to protect you. Okay, you're the one, and medical, dental, and nursing boards contact us about you, and we're here to really give you the information that you need so you don't get sucked in. All right, let's go ahead and just go through a little bit of the clinical. And this is, I'm going to show you a little bit of what these threads are. I'll show you a couple of before and after cases, and I'm going to hit on one more major point when it comes to threads. Now, from the clinical aspect as to what do we look for in the AAFE when it comes to threads. And I could say this, there are 2 or 3 good companies that are out there, but again, now I'm going to go to the real differentiating factor from a clinical standpoint for this. Smooth threads, mono threads, they're called by different manufacturers for that. 29 gauge, 31 gauge, just for you to get an idea. Many of you know this already. And again, because we use VSoft primarily, these are lifting threads on top, molded threads. If you've never known the difference between a lifting thread and a molded thread, the major difference is a lifting barbed thread has got those little barbs coming out. Now again, in our testing, and again, in our opinion, you may have a different opinion, but I can tell you that the thousands of AAFE members and other people who are not AAFE members trained, certification training by the AAFE, they love VSoft Lift because they are the strongest that we tested, and we tested the ones on the market in the US and from around the world for that. Oh, I forgot to mention one more important thing. One other fallacy of training. Companies say that we give you certification training, and then they tell you, yes, you'll be certified to buy our product. There's no CME. that is ridiculous. There's no CME. There's no curriculum. It's just that's ridiculous. Okay. Oh, you'll be certified to buy our product. Okay, as if they would deny you if you just call them out of the blue for that. You need real certification training, CME. The other question your board is going to ask you is what? Where's your training in this? And if you show them AAFE certification training, they certainly know the AAFE. With real CME, dental continuing education, nurse practitioner, we've got them all for that. All right, back to this. The lifting barb threads by VSoft Lift we tested, they were among the strongest, we would say, in our opinion, the strongest by far over most of the other threads. Some of the other threads came a little closer. Their molded thread is even stronger than that. So from a quality, from a collagen production, from a strength, and certainly from an economical thing, because they are very economical compared to just about every other thread on the market, that's why we went with VSoft Lift. This is not VSoft Lift. This is from an article. This shows you why we love PDO threads. It is because of the incredible collagen production that happens as they break down. Those of you who are brand new, I would assume that that this would interest mostly people who are either very close to looking to get into this or already into this. But what we love about this is collagen production for this, and the studies on collagen production, this is from the Journal of Cosmetic Dermatology, I mean, can go out 48 months. This is an unnamed PDO thread. I want to make sure I make this very clear for this. This is an unnamed PDO thread, but certainly PDO polydioxanone threads, better than PCL, better than PLLA. Those have other issues, and there's no time to really talk about those right now. For that. And Nicole, check your thread. I mean, if you use a certain brand of threads, check those in your packages and make sure that they are properly labeled. If not, you don't know that you're getting the 510K product for it. Okay, here's the other major thing, and this is something that, you know, I hope it brings some attention to this. I don't know who this slide belongs to. Some AAFE members or people will post this on our forums or show this from people who post it publicly on Instagram. I mean, what's wrong here? Okay, what's wrong here is if you need this many threads to produce collagen, then you're using the wrong thread. Because some of the other threads, and the V-Soft Lift has a special polymer coating which causes it to break down slower and give you more collagen production than the others. That's the mechanism of action over time. If you need this many threads to get collagen production, it's simple. You're using the wrong threads. The more threads you put in, the more problems you can have. It's that simple. And who wants this many threads? Now, I don't know if this is the manufacturer who's trying to sell more threads. I don't know if there is, yeah, right. I don't know if there is, if this is someone who's trying to upsell a patient, or I've seen on social media where people say, no, you need this many to get collagen production. No, you don't if you're using the right thread. And certainly for us, it would be V-Soft Lift. For others, it would be other threads. So I guess it all comes with the protocols and training. But this is only a part of the thing. Yeah, Nicole, it is true. There is a little blood. And if you guys can see this, but there's a little blood in this hub if you look very carefully. You know, I don't know that that's that meaningful. It just means you're in. Yeah, if this was filler, then that would be a vascular event and would be really crazy. And yes, I agree. It could be a shock and awe photo to gain attention on Instagram. Yeah, but the patient, what about the patient? Shock and awe, you know, that's part of what's wrong with our society, I guess, and social media, is that we're putting patients at more risk, and this because we want a good picture on Instagram. But they are very Instagrammable moments for what it's worth for this. These are our cases before and after using V-Soft Lift. You can see we do a series of for acne scars and cheek fill. Look at that cheek fill and collagen production. These are 3 treatments, 1 month apart. This is after the first treatment. This is not even the third treatment here. So there's no question for us, and the reason we use V-Soft Lift was because, again, I'm not knocking others. Others can get similar results. Go ahead and show it to us and prove it, and we're all for it. For temples, give me PDO threads. Again, this is a V-Soft Lift case. Got to give them credit. Go give credit where credit is due. Filler in the temples, sure, we do it all the time, but filler won't take care of that acne scars. PDO threads will. And again, this is a V-Soft case. This was 6 threads. 6 threads in this area. This is between the second and the third treatment. Okay, compare that to if you're using PDO threads, what you are getting for results for that. 6 threads each time, certainly in each temple, so 12 threads total for both sides for that. Can your PDO thread do that? I mean, that's a challenge. Now again, this is an immediate after, okay? And now, no bruising is just by luck more than anything else. But this is an immediate after, okay, with a 3-vector lift and a 2 threads for jawline for all of that. So that is that you can see, and that is amazing for that. Now I go back with filler, and now I go back to everything else here. That is not a problem there. And somebody's asking about the VSoft Lift 510K. It's there. Go ahead. If you know how to search the FDA, it is there, clear as day, for all of that. And again, you've got to know how to use that website. It ain't easy sometimes, but you can find all the ones I just mentioned, just like I can find. Certainly helps to have people that know the FDA website and how to. They don't make it too easy for you, but it's all there as clear as day for that. Here is a patient before and after. Lips are bruised because she had lip filler at the same appointment here for that. This is 3 lifting threads, 3 vectors means from, we'll just say generally, from the zygoma or from the cheek all the way down, and 1 jawline thread on each side. So a total of 4 threads each side. Tell me if your thread can go ahead and accomplish this for that. She did have a couple of neck threads. There are 2 that she wanted. I'm just looking at the face, but the neck would require a couple of 2 additional threads. I've seen 15 threads in the neck for that. So really, this is all about this for this. No, this is not an immediate after. I'm sorry, I didn't make that clear. This is about a week later when she went home. She lives about 2 hours away from our office here. Glad to see that some of the PDO thread competitors are up and active today. Up on here. I mean, we expected them all to be here, but I'm here to protect you. I'm not here to protect the manufacturers here. They've got to deal with their own problems for all this. All right. If you do PDO threads, ComfortTox Remove is a great product from statdds.com. I'm just going to show you this because we get this question so often. What happens if I have to remove a thread? There are times you're in the wrong plane. Things happen. These are medical grade instruments, and I'll show you what they look like afterwards. But let me show you a quick video, and you can see this here. Let's demonstrate the use of the ComfortTox Remove retrieval instruments. They are amazing. They're really designed for maximum efficiency. They come in 5 sizes of instruments, and we may use different sizes for each case. So in this case, because during placement, it was a little superficial. You can see that line a little too superficial in her skin, and we decided we're going to take this one out rather than try to smooth it down, which we tried to put it into the right plane. And sometimes this happens, so you've got to go ahead and remove it here. So you get the patient numb, and you go ahead and use an 18 gauge pilot hole needle right at the area where you think you could grab it and where it's most superficial. Or a patient comes back in a couple of weeks later and something didn't integrate correctly and there's a little bump. Same procedure. You're going to go ahead and use these. Now these are using the super smooth technology that's used in the ComfortTox microcannulas. Super smooth, super blunt, very safe for all the delicate structures that you're going after. And you may use a couple instruments till you finally hook that, and it is so satisfying when that finally comes out for this. So this is some insurance for your office. You should not be doing PDO threads if you do not have ComfortTox Remove instruments. It's like having hyaluronidase. If you do filler injections, you must have it in your office for this. This is your backup plan, and so you must order ComfortTox Remove instruments today. They are absolutely fantastic. Is cheap insurance. It is, I think they're $220, $250, something like that. You can get it at statdds.com. They are autoclavable. I don't know. I'm just saying 1,000 times. It's something you buy once and you pretty much have it forever. You can see compared to all these things. Yeah, I've been told that they look like needle point or crochet hooks. I would not use crochet hooks. You are a professional, and you can go ahead and again, if you use them, they're just cheap insurance for all of that. And so that is that. Just before and after, you can do incredible things. These are all PDO VSoft Lift, PDO threads. Again, use what you want. Just make sure that they are the right kind of threads. I mean, that's called, and the right techniques. I mean, that's it for all of that. And here's by one of our faculty members on a friend of hers, and you can see, take a look at that. But it's what we can do with Botox fillers and solid filler PDO threads is just amazing all the way around. So that's really all I have for you. I hope I kind of give you an idea of what to think about if you're looking at PDO threads, or if you're thinking about getting into PDO threads. By all means, feel free to email me for that, and certainly we give constant webinars in the AAFE, AAFEwebinars.com. We actually have the only smooth PDO thread live virtual certification training, which you can train right from the comfort of your own home for that. So you can see that at AAFEvirtual.com, SatTDS.com for the whole ComfortDocs brand of products, including that ComfortDocs Remove and AAFE training for the training options for all of that. So with that, I hope I gave you something to think about, and you be careful. Just like you are not going to use and we just had this. We just had a dermal filler company, one of these companies that say, yeah, buy the dermal fillers from us. They just get them from overseas. They sell them here illegally. I don't know if you remember a few years ago when I don't even remember a few years ago when the FDA actually sent out to many med spas, medical practices, aesthetic practices, a letter saying, if you don't buy FDA cleared class 2 products or real pharmaceuticals, and they came down and they gave out some hefty fines for all of those things. Same thing here. PDO threads is no different. So make sure you know what you're buying. Make sure that it's FDA cleared class 2. Make sure it's proper packaging, which then identifies it directly to that 510K. I'm sorry if I've got a lot of you professionals who care about your license that are very happy, and the thank yous have been coming in quite a bit. We've certainly got competitor threads on here, or threads on here that are FDA cleared class 1, who are, I won't repeat some of the words, but listen, get your act together. People have got to know the truth. I don't think that professionals should be fooled, and they've got to know what, and people have got to tell the truth as to what you can go ahead and buy. So with that, I want to thank all of you for your attention, and we will talk to you all again soon. AAFEwebinars.com. Again, we'll be on probably next week, the week after, and we constantly show on our Facebook and Instagram so many of the techniques, so many of the patients that we treat every single day in the AAFE training centers and from courses there. So you can check us out, find out what the latest techniques are, and we are happy to help you. Feel free to email me if you have any questions, and continued success to all of you, and we will talk to you all again real soon.